Assalamualaikum warahmatullahi wabarakatuh. Introduce myself. My name is Winia Jumiani. I will explain speech children with genetic disorder. Children with genetic disorder. Definition: genetic disorder is a condition in which there is a change in the nature and components of the genes causing disease. This condition can be caused by new mutation in DNA or abnormalities in genes inherited from parents. B. Definition of the type of genetic disorder. 1. Down syndrome. Down syndrome is a genetic related disease that results from mutation in chromosomes where there is one extra copy on the 2021 chromosome. Symptoms: moderate to severe mental retardation and abnormal skeletal development are present at birth. 2. Phenylketonuria or VKU, a genetic disorder of phenylalanine metabolism. Because 20 essential enzyme is missing, the phenylalanine contained in all natural protein foods cannot be converted to tyrosine. Diagnostic test: urine testing. Symptom: a normal newborn becomes dull and lethargic by 4 months of age. 3. Cystic fibrosis, a genetically transmitted disorder of exocrine gland function causing chronic pulmonary disease, pancreatic deficiency, and high sweet electrolyte level. A diagnosis: positive sweet less absent pancreatic enzyme from duodenal secretion, pulmonary change on X-ray, and a family history of the disease. Symptoms: full, fatty, frequent, bulky stool, failure to gain weight progressing to malnutrition or emaciation. Respiratory symptom is cold, dyspnea, cyanosis or recurrent infection. Salty taste to the skin. 4. Sickle cell anemia or typhus. Sickle cell anemia is a type of anemia caused by a genetic disorder in which the shape of the red blood cell is abnormal, causing the blood vessel to lack a healthy supply of blood and oxygen to distribute throughout the body. Diagnostic test: peripheral blood smear or sickle cell preparation test will demonstrate sickle cell. Hemoglobin electrophoresis will differentiate from disease. Symptom: during a crisis or acute exacerbation of sudden onset, the symptoms vary with location of occlusion. 5. Celiac disease. Celiac disease is an autoimmune condition that causes damage to the small intestinal villi and impaired absorption of nutrients. Sufferers should avoid eating foods containing gluten to prevent symptoms. Diagnosis: physical exam, jejunal biopsy, a 72-hour stool collection for fecal fat, and later a beneficial response to a gluten-free diet. Symptom: onset of food malabsorption at some time after gluten foods are introduced into the diet. Stool are largo, bulky, foul-smelling, greasy, and poorly formed, or steatorrhea. Next, 6. Juvenile diabetes mellitus, caused by decreased or absent insulin due to beta cell atrophy. The disorder is felt to be genetically transmitted, although the mode of transmission is poorly understood. Diagnosis: elevated fasting and 3-hour postprandial blood sugars and abnormal glucose tolerance test is the best diagnostic measure. Symptom: severe and abrupt onset of polyuria or especially bedwetting, polydipsia and polyphagia, weight loss, chronic fatigue, and a random appearance. Okay, I think it's enough. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.